for a healthier future.
Have you ever had a moment when someone you love doesn't recognize you? Or have you noticed that they always ask the same question? This is exactly how Alzheimer's disease sneaks into our lives and robs us of our most precious memories. So, what is Alzheimer's? How does it start and is it possible to prevent it? Let's answer all these questions together. Part 1. What is Alzheimer's? Alzheimer's is the most common form of dementia and is usually characterized by memory loss. It starts when proteins called beta-amyloid build up in the brain and form tangles in nerve cells. This prevents brain cells from communicating with each other and leads to cell death over time. Alzheimer's is often a slowly progressing disease. At first it starts with simple forgetfulness, such as when a person often loses their keys or cannot remember events in the recent past. Over time, however, the memory loss becomes so severe that it affects daily life. Eventually, the person may not recognize their loved ones or even themselves. Part 2. Alzheimer's symptoms. So, what are the symptoms of Alzheimer's? Here are some important signs to look out for. 1. Memory loss. Common forgetfulness affecting daily life. The most common symptom of Alzheimer's disease is memory loss. These forgetfulnesses are not temporary, like a simple "I forgot where I put the keys," but recurrent and seriously affect daily life. For example, the person may ask the same question over and over again, forget important dates or events, and not immediately recall new information. In more advanced cases, they may even forget recent events or the names of family members. 2. Decision-making difficulties. Difficulty making simple decisions. Alzheimer's also affects an individual's ability to think logically and solve problems. Decisions that are easily made in daily life become confusing for patients. For example, they may find it difficult to choose a product while shopping or to choose clothes that are appropriate for the weather. In more complex cases, managing finances, paying bills, or even following a simple recipe can become impossible. 3. Confusion. Confusing time, place, or people. People with Alzheimer's often forget where they are, why they are there, or how they got there. They may find it difficult to keep track of dates, seasons, or daily routines. For example, they may not understand what time of day it is, or they may remember an event that happened many years ago as if it happened today. This confusion can pose a serious risk to a person's safety, especially in the later stages of the disease. 4. Difficulty speaking and writing. Difficulty finding words or not completing sentences. People with Alzheimer's often struggle to find the right word or use the wrong word. For example, they may use vague expressions such as drinking thing instead of a glass. Also, pauses in speech, inability to complete sentences, or jumping from topic to topic are common. In writing, they may have difficulty organizing ideas that they were previously able to express easily, and inconsistencies may appear in their writing. 5. Changes in behavior and mood. Restlessness, depression, or withdrawal from social life. Alzheimer's affects not only cognitive functions, but also emotional state and behavior. Patients may lose interest in activities they used to enjoy. Emotional changes such as depression, anxiety, irritability, and restlessness are common. For example, the patient may avoid attending gatherings with friends, even if they used to be a sociable person, or they may have temper tantrums when they are normally calm. Behavioral changes can be challenging not only for the patient but also for those around them. Each of these symptoms can occur at different stages of Alzheimer's disease and can be very challenging for both the patient and those close to them. Early diagnosis and supportive care play an important role in coping with these symptoms. These symptoms may be mild at first, but can worsen over time, leaving the person completely dependent on care. Part 3. What causes Alzheimer's? Although the exact cause of Alzheimer's is unknown, some factors are known to increase the risk of the disease. For example, age. More common in individuals over 65. One of the most important risk factors for Alzheimer's is age. In people over 65, the incidence of the disease increases significantly. Biological changes that occur in the brain with aging prepare the ground for Alzheimer's. As the brain's capacity to regenerate and repair itself decreases, problems such as protein deposits and nerve cell loss become more pronounced. However, advanced age is only a risk factor, not the exact cause of the disease. Some individuals may not develop Alzheimer's until their 80s and 90s, emphasizing the importance of other factors such as lifestyle and genetics. Genetic factors. Family history of Alzheimer's increases risk. Genetic predisposition plays an important role in Alzheimer's disease. If a person has a family history of Alzheimer's disease, especially first-degree relatives, the risk of developing the disease increases. Certain variants of a gene called apolipoprotein E, APO, are one of the strongest known genetic risk factors for Alzheimer's. However, genetic factors only increase risk, this does not mean that everyone will develop the disease. It is also important to remember that even individuals with a genetic predisposition can reduce this risk through lifestyle changes and regular health checkups. Lifestyle. Inadequate physical activity, poor diet, and smoking may negatively affect brain health. Lifestyle choices can play both a risk-increasing and preventive role in the development of Alzheimer's. Lack of physical activity can reduce blood flow to the brain, leading to insufficient transport of oxygen and nutrients needed by nerve cells. Poor eating habits can also lead to a lack of essential vitamins and minerals that the brain needs. For example, a diet rich in antioxidants and omega-3 fatty acids can help lower the risk of Alzheimer's by reducing inflammation in the brain. Smoking is another factor that significantly increases the risk of Alzheimer's. Smoking accelerates damage to brain cells by causing oxidative stress and vascular damage. Furthermore, diseases such as high blood pressure, obesity, and diabetes have a direct impact on both lifestyle and Alzheimer's risk. Adopting a healthy lifestyle can reduce the negative effects of these factors and help maintain brain health. But the good news is that it is possible to reduce this risk by adopting a healthy lifestyle. Exercising regularly, eating a healthy diet, and keeping the mind active are important steps in protecting our brains. Part 4. Treatment and prevention. There is no definitive cure for Alzheimer's, but some medications and therapies are used to slow down symptoms and improve quality of life. Doctors often recommend mental activities in combination with medication, such as solving puzzles, reading books, or participating in social activities. As for prevention, here are a few suggestions. Exercise regularly. This increases blood flow to the brain. Physical exercise is an effective way to keep not only your body healthy, but also your brain. Exercise increases blood flow to the brain, allowing more efficient transportation of oxygen and nutrients needed by nerve cells. Regular aerobic activities stimulate the secretion of neurotrophic factors that support the growth of brain cells and improve memory and learning capacity. Activities such as a 30-minute walk a day, yoga, swimming, or light jogging can be highly effective in reducing the risk of Alzheimer's disease. Exercise also reduces stress levels and prevents cortisol-induced damage to the brain. Eat a healthy diet. Dietary patterns like the Mediterranean diet benefit brain health. Brain health is directly influenced by the food consumed. Healthy eating patterns, such as the Mediterranean diet, are one of the most effective diets recommended to reduce the risk of Alzheimer's. This diet includes olive oil, fresh vegetables and fruits, whole grains, fish, nuts, and foods rich in antioxidants. Fish rich in omega-3 fatty acids strengthens nerve cell membranes, while antioxidants protect brain cells from free radical damage. Also, avoiding processed foods and excess sugar plays an important role in maintaining brain health by preventing inflammation. Adequate water consumption should also be remembered. Dehydration can lead to impaired cognitive function. Keep your mind active. Learning something new can strengthen connections between brain cells. Exercising your brain regularly is vital for strengthening the connections between nerve cells and creating new connections. Mental activities such as learning a new language, playing a musical instrument, solving puzzles, or reading books increase your cognitive reserve. This helps brain cells to maintain their function even when they are damaged by aging or disease. Also, participating in social activities allows different areas of the brain to interact and has a protective effect against Alzheimer's. The more active the mind is, the longer the brain can stay healthy. Pay attention to your sleep pattern. Quality sleep helps clear brain toxins. Sleep is essential for brain health. During the night, our brain cleanses toxins accumulated during the day and strengthens the connections that support the transfer of information between neurons. In particular, quality sleep plays a critical role in clearing beta-amyloid protein deposits, which are associated with Alzheimer's disease. Insufficient or irregular sleep can lead to the accumulation of these proteins, increasing the risk of Alzheimer's. Getting 7 to 8 hours of uninterrupted sleep every night allows the brain to repair itself. Limiting screen time before bedtime eases the transition to sleep and improves sleep quality. Also, establishing a regular sleep routine regulates the brain's biological clock. Remember, early diagnosis and healthy habits are crucial to minimize the effects of Alzheimer's. Today we talked about Alzheimer's disease and how to prevent it. I hope this information will make a difference in your life and the lives of your loved ones. If you would like to know more about this topic or would like to share, please leave a comment in the comments. Remember, the most valuable treasure you have is your health. If you like our video, don't forget to like, subscribe, and turn on notification for our new videos.